some of the current resources available to the public, and some of those changes that may or may not be happening in the coming months. Just want to remind everyone that this webinar is being recorded, and I will send a downloadable copy via email for all participants in today's meeting. In addition, after Dr. Weston's remarks, please feel free to unmute your mic to ask any questions or follow-ups to him directly, or you can place your question in the chat and I will read it aloud. And so with that, Dr. Weston, I will give you the floor.
All right. Thank you, Brandon. Good afternoon. Thank you, everyone, for joining. On March 13th, 2020, 3 years ago yesterday, we identified our first known case of COVID-19 in Milwaukee County. Now, the next day, we identified our second case, but since that time, we've seen hundreds of thousands of COVID cases in our county and 2,345 deaths. We've all been through a life-altering segment of our collective history. It's been challenging, frustrating, and at times heartbreaking. But today we have reason to be thankful. As we near the fourth year of the COVID-19 pandemic, we're in a far better place than in the past. Our disease burden shows signs of decline as we critically see the lowest level of hospitalizations in 10 months and relatively rare deaths. Our community level finally reached low several weeks ago, and with our declining hospitalizations, we can be hopeful that persists. Now, perhaps most significantly, we have completed a year without a significant surge in hospitalizations. We've been through winter, spring, summer, and fall without a surge. Now, these successes have been multifactorial. Certainly, the nature of the virus has changed. While it's become more transmissible, our collective immunity has led to generally less severe disease. We also have more tools at our disposal, from high-quality masks and antivirals like Paxlovid that substantially decrease the risk of severe illness in more medically vulnerable populations, to a better understanding of how to treat critically ill COVID patients if they do land in the hospital. And of course, safe and effective vaccines. However, equally important has been the work of our health departments, our health systems, community organizations, and our municipal and county leadership in enacting policies and procedures to prevent disease spread, promote vaccines and boosters, and provide accurate health messaging. But in the end, the progress is due to each of you, the folks out there getting vaccinated, getting boosted, and taking precautions over the last 3 years at times of increased disease burden, and particularly around those most vulnerable in our community. So while we certainly celebrate our progress, we must continue to be cautious. Yes, we are turning a corner, but COVID has been unpredictable, so we must remain prepared. And that preparation comes in continuing to promote strengthening and maintaining immunity in the safest way possible through vaccines and boosters. It comes in providing high-quality masks in public spaces to decrease barriers to protection among folks who wish to use them. And it means continued caution among vulnerable populations and in high-risk settings, as deaths in these populations continue at far too high a rate. But our progress is undeniable. We are on the right path. Now we need to maintain our course. Thank you, and I'm happy to take any questions.
Hey, Dr. Weston, it's Spencer Tracy from FOX6. Can you hear me okay?
I can.
So I have a quick question. I actually talked to a mom that was pregnant during the pandemic. She has a 3-year-old daughter. Just talk to me a little about maybe there was some ramifications of a COVID baby, of not being able to be in social events or daycare. Just talk to me like that. Have you seen any long-term effects over these past 3 years?
Yeah, thanks for the question. You mentioned, I think I heard that she was pregnant. Now, I want to touch on that real quick because I think this is an important point. So 30% of women who are pregnant or planning to become pregnant believe COVID vaccine misinformation. But if you look at the facts, if you look at many, many studies, tens of thousands of women, we find that not only is the vaccine safe in pregnancy, it doesn't cause fertility issues, it doesn't cause any pregnancy complications, but COVID infection is not safe in pregnancy. It causes complications to mom, it causes complications to baby. But to, I think, your broader question of what sort of impact has COVID had on kids over the last 3 years, is that the question that you're asking more broadly?
Yes.
Yeah, I mean, I think the impact to kids has been undeniable. It has altered the last 3 years of their childhood in many different ways. Part of that has been through remote education. Part of that has undeniably been through the loss of a parent or a caregiver that thousands of kids across the country have experienced. So COVID has had a profound impact on kids. But what we can do, I think, moving forward is keep our immunity as high as possible, our kids' immunity and our own immunity, to prevent getting COVID, prevent getting long COVID, and prevent that sort of loss in the future as well.
Hi, Dr. Weston. This is Davey from the Journal Sentinel. I've heard a lot of people who are up to date on their boosters, from, I guess, the most recent one, the bivalent, kind of unsure of where things stand in terms of, you know, am I up to date? It's been a few months. At what point does the immunity wear off? Should I be concerned? And it seems like in the past there was more kind of uh, clearer dates and things of like when people should be getting shots. Also, just being, 4 times vaccinated, having, clearer expectations of if I get COVID, when should I get out of quarantine? Should I wait until I test out? Should I wait 14 days? Should I wait 5 days? And like a lot of these guidances that it seems like we had more clearly in the past are, it seems just a little bit more unclear. Could you talk through some of those recommendations and where things stand with where, what is up to date?
Yeah, it's a great question. I mean, up to date is defined as, well, being fully vaccinated, of course, is defined as having typically through the mRNA vaccine 2 doses. Up to date is defined as being up to date, so having your bivalent booster. And that's really what is most critical at this point, is getting that bivalent booster shot. Many of us got it back in the fall, but many people have not received it yet. In Milwaukee County, only 18% of folks have received their updated booster. Now, what population is that most important is? It's the 65 plus population. And in that population, we haven't even hit 50%. We're at about 49% of our population, 65 plus in the county, has received that bivalent booster. So if we want to target a group, that is the group to target. Talk to your parents, talk to your grandparents, your neighbors. That 65 plus group is the most important one to get the bivalent booster. But to the question of what comes next, I wish I could look into a crystal ball and say, I think it's likely that we'll move toward annual vaccines, and part of the annual boosters, I should say. And part of the reason why is that simplicity. When you have a simple scheduled vaccine, people are more likely to get it. And getting that vaccine is critical. We're at that time period, though, where a lot of folks, myself included, it's been probably around 8 months since I got my last booster. And so is my immunity starting to wane, or am I still quite protected? There's differing data out there. But the most important thing you can do right now is get that bivalent booster and be as protected as possible.
Thanks. And could you talk a little bit about the quarantine recommendations if people do get infected?
Sure, absolutely. So the quarantine recommendations remain what they have for several months. So basically what it is you want to, from your first day of either symptom onset or when you test positive, whichever one is earlier, you want to go 5 days with isolation away from other folks so you don't spread it. Those are your most contagious days. And then after that, you want to transition to 5 days with a high quality mask. And we're really talking about not a cloth mask, ideally not even a surgical mask. We're talking a KN95 or N95 mask to protect people as much as possible. Now, you can add on to that extra protection with a rapid antigen test, so the over-the-counter COVID tests. If that's positive, you're probably still contagious and still spreading to other folks. And the studies show that it's quite variable. Some people after 4 days are no longer contagious and can go out and socialize. Some people it takes 12 or 13 days. And so if you want to be as cautious as possible, coupling that isolation period with a negative antigen test is going to be important.
Thanks, Dr. Weston. Any other questions on the call? Feel free to unmute.
I'm just curious, coming into, year 4 of this, just personally, where do you stand in terms of thinking back over the past few years, and has it changed anything in terms of how you go about doing your job, or just see health in our community?
Yeah, it's a good question. I mean, the pandemic overall, I think, has been devastating to individuals, to communities. Likely, we're seeing that impact diminishing over the last few months, and hopefully we can maintain that trend. Now, nonetheless, COVID remains one of the leading causes of death in our country. It's largely among medically vulnerable folks, and that's why that booster is so important. But to the question of how it's kind of changed my interaction, and I think our community interaction on a health landscape, I think there have been some silver linings. We've learned a lot from COVID. We've learned the importance. We knew it, but we've learned and we've expanded on the importance of sharing data. We have our COVID dashboard. We still maintain that. And the importance of data transparency and data-driven initiatives. We see that not just with COVID, we see that with our EMS dashboard we released. We see that with our opioid dashboard. Yesterday, we talked about millions of dollars in funding for opioid initiatives. Those are data-focused, using a lot of the learning that we had from the COVID pandemic to understand disease burden in our community related to opioids. I think we're also seeing organizations working together like they never have before, whether it's our health systems, our public health officers, our fire departments, law enforcement. All of them worked together to some extent before the pandemic, but they've come together and stayed together like they haven't in the past. And each of those organizations overlap too. The county is talking with the health officers with the health systems more than they had in the past. So I think in some ways, we're in a better place with our health infrastructure, with our communications, and with our ability to target not just COVID, but other health initiatives as well to strengthen the health of everyone in Milwaukee County.
Any other questions on the call? All right, well, hearing none, I want to thank everyone for joining us this afternoon. And as I said, I will be sending around a link of the recording of this meeting today for folks to download for their use. Thank you very much for joining us this afternoon, and stay in touch for our next advising of media office hours on public health with Dr. Weston.
Thanks, everyone. Take care.
Thank you, Dr. Weston.
Thank you.